It is sad, but it is still a taboo topic in our Latino community. There is still a lot of doubt and confusion about what it really means to live with dementia. According to the Alzheimer's Association, dementia is not a disease in itself, but rather a general term used to describe a set of symptoms that affect memory, thinking, decision-making, and other cognitive functions. These symptoms are the result of abnormal changes in the brain and can occur in several diseases, the most common being Alzheimer's disease. This cognitive decline can become severe enough to interfere with daily life and a person's ability to maintain independence. Dementia is often referred to as senility or senile dementia. This reinforces a mistaken idea that memory loss is the normal part of aging. It is not. Aging does not necessarily mean losing mental abilities. There are other conditions that can cause similar symptoms. For example, thyroid problems or vitamin deficiencies, which in some cases can be treated or even reversed. Scientific research in recent years has advanced significantly in the understanding of Alzheimer's disease. Even so, the exact causes of the disease are still not known with certainty. Evidence indicates that it is a complex condition, probably caused by a combination of factors: the natural aging of the brain, genetic predisposition, previous medical conditions, and lifestyle habits. Hello, how are you? I'm Tsi-tsi-ki Félix. We are glad to have you with us today. And joining us is Dr. Shah. He's a professor and also a doctor at the University Medical Center. We are also joined by Perla Castro. She cared for her family, in this case her mother, and together with her siblings. Her mother had Alzheimer's for many years. It was not an easy journey, but they managed to do it. We thank both of them for being here with us on this LACARE podcast. Let's begin.
Yeah, maybe I can start. I was thinking we've probably known each other for about 15 or 20 years. I don't think I was the first doctor you saw when you as a family were looking for help with your mom and understanding memory issues that were going on. But I know I see some engagements we had in 2010 that we were talking about how do we keep educating people about memory loss, especially in the Latino community.
It's been a while. I'm trying to remember the name of the first geriatrician we saw at Rush, and I just can't right now. But we met at Rush when we were looking for answers about my mom's memory. I don't know, it's so many years and it still hurts because it was a very, very long journey through this. But we finally found some answers when we went to Rush. And we had visited many doctors here in the United States and in Guatemala because my mom started losing memory very early in life. I think we can go back to her late 40s, early 50s when we start seeing some of the signs. And there was not a lot of information out there. There was very little information in English, and there was really nothing that we could refer to in Spanish. So once we got to Rush, we found support and answers. And then we started asking for, how do we get this out? How do we share it with the community? And we were lucky to find David and other people that believed this was important. And we've been working ever since.
Yeah, so many years have gone by and so much great work has happened. But, you know, I'm as a clinician and then also working with families and understanding about research and education in my roles, there was a recent presentation at a international meeting that happened in Toronto last week about the significant delay it takes for people to find answers when they're noticing the memory troubles by the time they get a diagnosis. And on average in the United States, it's something like 4 years. But if somebody has it earlier, like your mom had it earlier, it can even be longer. And even for some communities that are communities of color, it even takes even longer than that. So we have a lot to still do. But I'm always curious, like you started to tell your story about your mom even before I saw her, that it was a long process. How many years do you think it took?
I think about 6. We were talking about this with my sister the other day. I think anywhere from 5 to 6 years of going from one doctor to another. She was getting tired too about going to so many doctors.
Yeah.
So once we went to Rush and we were able to get at that time a prognosis, not even a diagnosis, it's a difference, right? Then, I don't know, at first it felt like now we have answers. Little did we know what we were going to go through. But at that point, it felt a relief to find the information.
And that's what a lot of families tell us, right? Like they've been searching for a while. They've been trying to find answers. Sometimes they get very discouraged by the process. And so they stop, right? They stop asking questions or seeing what might be happening, trying to understand it better. But once they find an answer, even if it's imperfect, it helps them to organize as a family, as a group of caregivers. And, your father, your siblings, I was always amazed at how much work you put in as caregivers to support your mom. And that's not easy. And it takes, a need to not only help the person that is having the memory difficulties go through the process of understanding a diagnosis and then what to expect after the diagnosis and to be on that journey, but also to help the entire caregiving team to feel supported and the entire community to understand the needs about why you have to go through these processes.
Definitely important. But doctor, please explain to us, what are the causes, the triggers that are causing dementia in our Latino community? Mainly in this case, Alzheimer's disease. Please explain.
Yeah, that's a wonderful question. And it's one that I commonly get asked giving presentations in the community, because it's a little tricky because we sometimes use the terms interchangeably, dementia, and they're a little bit different. Dementia just is what we're observing, what we're seeing somebody expressing. And it's what we call in medicine a syndrome. It's a compilation or a grouping of signs and symptoms. So somebody's having troubles remembering what they did earlier in the morning, or they're having troubles driving to the local grocery store and coming back home, or they're having difficulties operating the dishwasher machine. And now it's starting to affect their lives. They can't do things like they used to. They're not socializing because they're worried about showing these symptoms. So when we see chronic cognition or thinking problems, we call that dementia. Now, there's many things that cause dementia, probably 100 or so, and they work sometimes together. They're not by themselves. The most common cause that we notice is something we call Alzheimer's disease. And we don't exactly know all the steps about how Alzheimer's disease creates a dementia. We know it involves eventually the brain cells dying a lot faster than they're being replaced. And as a result, people are losing their thinking functions and their abilities to do things. And we've learned a lot about that process, but we still have a lot more to go. And that's why we partner so much in research and working with families and people with conditions like dementia and Alzheimer's as one type of it to understand what might be happening.
And something very important we want to know, what are the signs? What are the symptoms, doctor, that someone should be paying attention to when this kind of illness appears in a loved one? What are the warning signs we need to take into account when we see someone behaving differently?
I think I'll let Dr. Shah answer that in general, but I can share our story. And it started with very, very subtle things like mom saying hi to us twice, or she'll give us a kiss when we walk into the door. And then later she'll be like, what happened? You're not going to give me a kiss? And like, Mom, I gave you a kiss. She'll be like, okay, give me another one. Or she will be warming up dinner and she'll forget that she had the tortilla on the stove. And next thing we know, we got the fire alarm going. And it started to happen so often that we start wondering what's going on. Then later on, maybe she was already noticing it because she was starting to have a hard time getting out of bed. And that was not my mom. My mom was the first one to get up and get us going. And trying to get mom out of bed was something new to us. So that's how we started noticing there's something not right.
And how many times have you had to explain how these situations happen? You ask for a kiss and suddenly the person asks you for another kiss again. Give us a little more insight into the situations you are facing while caring for this person.
I think maybe about a year and a half or two, because remember, she was so young, right? So she was going to the doctors on her own. It's not until one time I went with her and I just invited myself into the room and told the doctor what I was seeing. And she even told me
Yes.
What are you speaking of? But she couldn't kick me out of the room because they asked her, do you want her to be in the room? And then she didn't have the heart to kick me out. But I think it took about a year and a half after these subtle changes that we started really going with her to the doctor and trying to ask more questions that she will even be willing or brave enough to ask.
Doctor, when seeing these kinds of symptoms or doubts that you are experiencing, when is the moment that someone should take this person to a specialist and determine whether this person, in fact, has Alzheimer's?
Yeah, no, I think Perla gave some great examples of things she saw, and they're common. And what I'd like to say is, we all have memory lapses in our lives, right?
Right.
It's just a human experience to have memory loss, for an event or an episode, and we all do this. The problem is when those memory lapses or those thinking lapses start really becoming more frequent, and then other people notice it. And they start affecting people's lives. So Perla was saying, it became more noticeable that she was repeating things, or she forgot something on the stove that was cooking and set off the fire alarm and could have caused a problem. Or she wasn't doing the things she was doing before. That's really important for families to pick up on. And it's hard for the person because it's happening subtly to them that they may notice something is wrong, but they don't exactly know how to express it because they worry that their family members, their friends will start avoiding them. So they try to hide it. But it's important that we encourage families to believe in what they're seeing and experiencing. And then, taking the courage like Perla had to do to sometimes come in and talk with the doctors about what they're noticing too. I always wonder what it would look like if we had conversations with our loved ones, right? About dementia is common as people get older. It's a frequent condition that's not just part of normal aging. What would happen if mom or dad, you started noticing troubles with your memory? Would you want me as your daughter to let you know I'm noticing these things? And these are great conversations to have, like at a kitchen table, when people are not in the midst of a crisis, so that people are ready to talk about it and bring it up. And as far as your second question about, when to go in, right? I think you go in when you're noticing it more and it's of concern. And who do you go into? Well, the ideal person to see is the person who's probably been taking most of the care, the primary care physician, the family physician, the general internist, and start there because they've been maybe, following for a long time. But most physicians only see the person maybe 2 times, 3 times a year. A family member, maybe seeing them more frequently every day. So you'll pick up on things that a doctor may not pick up in the office in one visit, because the person having the memory troubles will do their best to cover up how they're doing in that visit. So it's important to get those other signals from family members to really understand what's going on and to start the process and journey of finding an answer.
Definitely. This is crucial. As one begins to notice these kinds of signs, doctor, how should the topic be approached? How should the situation be handled? In fact, do we keep the information to ourselves, talk with our loved ones who may be facing this, or even speak with the family to see what kind of strategies can be carried out in an organic and natural way with everyone involved? What do you think can help us reach that point and make things a little easier for our loved ones? Is it important to talk about the issue with the entire family together? How would you recommend handling it?
Yeah, I think we have to normalize this conversation that people can have, that it's not a sign of shame if you're having troubles with the memory, that You can't talk about it. And I will say groups like the Alzheimer's Association and working with other groups, even groups in media, have done a better job in kind of telling the story that Alzheimer's disease can happen. Like even in Spanish TV and some of the telenovelas, they'll have a character that has developed dementia and they'll talk about going through the process as a family. That ability to see it on TV, like somebody going through that and acting it out, can help somebody to feel a little bit more courageous, like, hey, I can do something too, and I should go in, and it's okay for me to talk about these things. Now, I will say, like, how you bring it up in a meeting with a clinician is really important. A very nice place, if you're over 65 in the United States, to bring up that conversation is we cover something called an annual wellness visit as part of Medicare. And that's an opportunity to talk to your doctor about your general health and well-being. And one of the questions they'll ask about is, how is your thinking? And that's a really good opening to at least have that conversation and to start the process. The other points are try to bring it up with your list early on when you come into the meeting. So the conversation doesn't just get taken away by all the other health problems. It's very hard for the doctor if they're finishing up the meeting with you, and then you say, oh, by the way, I think I'm having memory troubles. Because in the head of the doctor, they're going to be like, oh my, that's going to take me a little bit longer to unpack. I can't do that in the 2 minutes I have right now. All I can do is tell you, like, that's an important issue. Come back to me, and we'll talk about it a little bit more in detail. But really make sure you carve out that time. It's ideal when you're going to have that conversation, bring a family member along, or have somebody else there so the doctor can hear both sides of the story about what might be happening and get the full picture. But what I tell families, the most important thing to realize is trust your senses about something is wrong. Bring it up. If you have that conversation with your doctor and they say something like, oh, that's just part of normal aging, or don't worry about it, everybody goes through this. If you can't redirect the doctor to think a little bit differently about that and give you the time to listen to what your concerns are, you may need to find another doctor. And that's okay. And Perla was telling that story early about her experience of going through multiple doctors. But I think it's sometimes important, right? Like if you're not really getting a feeling like you're being listened to or getting the answers, don't just give up, right? Like try to find if you can see another doctor and get another opinion.
Now let's talk about the next steps. We have decided that this is something abnormal, something different. We take our loved one to the doctor and they receive the diagnosis. How does this prognosis work, doctor? Is an exam done? How long does it take? What can be expected at this moment when someone is going through this circumstance with a father or a mother?
Yeah, this is a very fluid area right now because there's some new technologies coming out that will probably help us a little bit better than what we had in the past. But I will still say the fundamental way we make the diagnosis, start with making a diagnosis. Thinking problems that are lasting for more than 6 months and they're affecting your day-to-day life. Well, mild cognitive impairment, you're bringing up that there's memory troubles or your family is saying that, or thinking problems. It's happening for more than 6 months, but you're still functioning pretty well. You're doing your grocery shopping, you're handling your finances, you're managing your day-to-day life. When that is the case, the memory problems are happening, but it's not affecting function yet, we call that mild cognitive impairment. And then it starts affecting function, we call it dementia. So it's important that we first make that diagnosis. Now, there's no perfect test to do that. I don't have an easy blood test to make a mild cognitive impairment or dementia diagnosis. I have to ask as a doctor. I have to talk with the family. I have to get a sense that the story is happening. I have to check some things on the physical exam, making sure it's not something due to a stroke or Parkinson's disease. And then I have to check some regular blood work to make sure it's not a problem with the thyroid not functioning well, or low vitamin B12 levels, or their blood sugar is out of control if they have diabetes, because those are fixable things I can do. I also have to ask about how the person's mood has been, because we know that when people have depression, it can sometimes look like they're having thinking problems. So I have to ask questions about the story, and then I have to check their exam, and then I have to do a couple of basic blood work tests that you commonly get. And for some people, I have to get a brain scan just to make sure there's not been a stroke area that I can't see on exam, and the only way it's presenting is by memory problems, or there's a mass. But that's it, right? Like we still, and that's what I teach family physicians and other doctors, like how do we get better at that with our constraints? Now, in today's world, if I can make that diagnosis and I can say my working thought based on what you're telling me is that you have mild cognitive impairment or dementia, we just approved the first FDA blood test to detect if you have the markers for Alzheimer's disease. I can also do that by looking at a brain scan called a PET scan, or I can do that by looking at the fluid that bathes the brain called cerebrospinal fluid with a lumbar puncture. But we look at molecules in the blood or in a CSF or imaging of the brain, and we're seeing if these proteins are building up, what we call amyloid or tau. And if we see enough of that, we can now use this blood test to say that, oh, this dementia or mild cognitive impairment is most likely being run or driven by Alzheimer's disease. Honestly, 6 months ago, we didn't even have that possibility. So that's why it's so fluid right now. And we're going to start seeing these tests become more available. We have to teach primary care physicians to use it the right way. These tests were never meant to be used when somebody's just having memory problems and we haven't made the diagnosis, because they don't work that well in that setting. But once you've made the diagnosis, it can help to guide, like if it's Alzheimer's versus something else.
And we arrive at that moment when the doctor tells you, in fact, your loved one has Alzheimer's. From there, where do you go? What do you do when this diagnosis arrives?
Earlier, it was a relief. We've been looking for answers for so long, right? So finally understanding, okay, now we have something to work with. We didn't know what we were going to go through. Little did we know that monster that this was. And what we did is have like family meetings and having a lot of conversations of what things we were going to do. One big mistake we made is we bought a new house because Mom wanted a new house. They were living with my grandparents. And we bought a house with stairs, like 3 levels of stairs. So just to give you an idea, things that we didn't know, right? Now going back, we would have maybe just buy a condo, right? But it gave us information so that we could act. Now, knowing better, we would have made different decisions. But it helped us get together and create a system with the family on how to take care of Mom. The system changed because there were so many years and so many different stages and phases to this that the system kept on changing. But I'm happy that we were able to take care of our home.
Doctor, let's speak plainly and let's see where we stand regarding treatment, medicine, or some cure for Alzheimer's disease. Where are we today?
Yeah, also some dramatic shifts after multiple years of working with families and different clinical research to look for better interventions. So I think there's three things to talk about there. The first thing, what I tell family is what you're trying to do to help treat somebody that you've made a diagnosis with dementia is you're trying to form the treatment to be like a pyramid. And with the pyramid, on the bottom of the pyramid is education, right? Like patients that come to us, the first time I say that I think that your problem is due to dementia, they don't hear anything else I say after that. Because it's just so much. It's a shock, right? So I tell them, like, before I even say, like, okay, you're here today, we wanted to figure out what was happening with the memory troubles, and based on what I'll say is I think this is dementia, and was what dementia means. And I know you're going to have a problem absorbing what we do as next steps, but I'm going to write you a letter, that's after the visit, and you'll read it and you'll talk about it with your family and you'll come back with your questions because they will generate questions. But for today, we're just going to deal with the diagnosis, right? But you want to start building that question and education, because some people will think like, oh, they just diagnosed me. So that means like tomorrow or 3 months from now, I'm going to be in a nursing home. The reality is not the case, right? Like most people live for many years and have a lot of good living they can still do and participate in family activities and be the best person they can be, even when this disease is happening, to participate and engage. So we have to change some of the expectations, right? And help people that it's not going to be a short-lived condition or it's going to be a rapid solution, but we're going to have to work together on a journey and adapt and adjust. So you have to keep working with people and giving them resources like what LACARE is trying to develop and put out there for the Latino community about what to expect, how to help yourself through this, what to learn from other caregivers so that they can share stories and experiences. The next level is sort of, after education, is sort of building on getting resources and support to help you as a family. So the person is always in the center that has the condition, but then it's their caregivers. And what I always say to caregivers is like, if we do not take care of you as a caregiver, the person with the dementia is not going to do so well. It has to be we treat both of you, right? And it's important for sometimes the caregivers to have respite or to take time off or to have other support. So who do you have to build around the caregiver for support? You have to build other community groups that can help provide services and other family members or friends. And that's building a dementia-friendly community to support people over time, reduce stigma, let people enjoy their quality of life and not feel so isolated. And then the final thing is like preparing for legal and finances, so nobody takes advantage of the person. That there's a set plan about what their wishes are as they can continue with the condition, so family knows how to act. So you have to build that support system, education support system, and then the tip of that is medications, right, or treatments that we can provide. There's sort of 2 treatments we're learning about just again this week at the big meeting after a big trial. We're finding lifestyle interventions, maybe early before a dementia diagnosis, can help people to maintain their cognition for longer. So we're going to always encourage people to stay active and maintain their nutritional well-being, their social well-being, stay cognitively active, control their diabetes and blood pressure. We're going to do everything else we can to take care of their health. And then in the medications and treatments for the dementia, for about 25 years, we had some medications that are pills that you could take. There were about 3 of them, and then in combination, there are about 5 or 6 now. But they helped with the symptoms. They kind of helped us, manage the symptoms. They didn't slow what was happening in the brain. Now, recently, in the last 2 years, 2 medications got approved that are through infusion that remove the amyloid in the brain. They're not for everybody. Very few people will qualify for them. But they're the start of the first treatments where we can maybe slow down the proteins changing in the brain. So it takes an entire system we have to build, and it's not going to happen overnight. And we got to keep talking and adjusting with the family and their expectations to help them through the course of the condition.
We're definitely moving forward little by little with regard to Alzheimer's disease, especially with information. But touching on the subject of our community, Latinos, how can they better be informed themselves, participate, and even be more proactive when it comes to this illness regarding our community and our health?
Thank you for asking that question, because it's so important at this point. The fastest growing communities in the United States where dementia is developing are in communities of color, including the Latino community. We know that the treatments have to be tailored for people from different cultural backgrounds to work the best. So we need participation to learn, why people develop dementias can be different, and then how do we provide interventions to help them. It doesn't help us to say that there's a lifestyle intervention that maybe involves a certain type of diet when the community doesn't follow that diet in their general practice. We have to adapt our lifestyle interventions to fit with people's cultural and personal backgrounds. So I consistently will encourage anybody to participate in studies because that's the only way we learn together. It's a partnership, and we value people who take the time to participate with us in the journey of learning together. And then we add some really remarkable things that helps millions of people in the future.
We'll definitely have to do our part and try to participate in this whole process. Because in the end, Dr. Perla, and I have said many times, we are all headed there. And we all have to unite and create a kind of army to face these circumstances. Thank you very much, Dr. Raja, for this information. Perla, thank you so much as well for sharing with us your story and, of course, this new movement to create awareness about Alzheimer's disease. Thank you both. And thank you all for tuning in. I'm Tsi-tsi-ki Félix. We'll see you next time on LACARE Podcast. This LACARE podcast has been produced in collaboration with Illinois Brain Health Project, and they have important tips so that you can try and stay healthy and avoid Alzheimer's disease. Take a note. Stay active instead of spending your time on social media, watching TV or doing nothing. Get up, walk, move. It's crucial. In the same way, diet matters. Of course, we like chips. Sometimes we like processed foods. Many things are delicious. But if the diet is healthy, we will have fewer chances of being sick in the long term. It is also important to control medical conditions such as blood pressure and cholesterol, and to stay very aware of where these conditions stand within our bodies. We should also challenge the mind. That means doing things differently, engaging in different activities. If you usually get out of bed from one side, try getting up from the other side. If you drive to work, try taking a different route so your brain stays constantly alert and continues developing. Neurons function better when we do things differently and try to train the brain in completely new ways. Sleep at night is also one of the most important things for human beings, and unfortunately, phones are affecting all of this all the time. Thank you very much. This was a great collaboration, and until the next time.